Imagine this for a moment. Right now, as you're watching this video, changes could already be happening inside your brain. Changes so subtle that not even the most advanced scans could detect them yet. And here's the chilling truth. These tiny, silent shifts can begin 20 years before an Alzheimer's diagnosis. That's 2 whole decades of slow, hidden change before the first obvious memory lapse. Now, before we go any further, I want you to stay with me until the very end, because I'm going to share not only the most overlooked early warning signs of Alzheimer's, but also simple, science-backed steps you can start today to protect your brain. Steps that could mean the difference between a sharp, vibrant mind in your 80s and a slow decline you never saw coming. And at the end, I'll tell you about the powerful daily habit in our next video. 30 days taking turmeric and this will happen. That can be a true game changer for brain health. But first, if you care about keeping your mind young and your memories intact, hit that subscribe button now. Join our community of women who are choosing natural, practical, and science-based ways to age with clarity, confidence, and joy. Alright, let's talk about why this topic is urgent. Most people think Alzheimer's starts with memory problems. But scientists now know that the disease begins long before. The brain's warning lights start flashing in ways we've been taught to ignore or chalk up to stress, aging, or personality changes. And that's the danger. Because when we ignore those early signs, we lose valuable years when lifestyle changes, nutrition, and daily habits could actually slow, or even halt, the damage. So let's walk through these silent signs together. As we go, I want you to think about yourself, your friends, your parents. And remember, having 1 or 2 of these signs doesn't mean you're destined for Alzheimer's, but it is your brain asking for help. The first silent sign can appear 20 years before diagnosis, and it has nothing to do with memory. It's changes in your sense of smell. Researchers have found that a reduced ability to detect or recognize smells, especially subtle scents, can be one of the earliest indicators of Alzheimer's. Why? Because the olfactory nerve, the one responsible for smell, is directly connected to the part of the brain most affected by the disease. And here's the tricky part. Losing your sense of smell often goes unnoticed. It's not like pain or vision loss. It's quiet. You might just stop noticing the smell of your favorite flowers, your morning coffee, or a loved one's perfume. Now, I know what you're thinking. Losing smell could be allergies or a cold. And you're right, it could. That's why this isn't about panic. It's about paying attention, especially if this change lingers for months and seems to come out of nowhere. The second early sign is subtle vision changes. And I don't mean needing stronger reading glasses. Alzheimer's can affect the retina and the brain's ability to interpret visual information years before memory issues begin. You might find it harder to judge distances, struggle with contrast, or have trouble recognizing familiar faces in a crowd. Sometimes, reading feels less comfortable, or driving at night becomes stressful even though your eyes test fine. The third sign is one most people never connect to brain health. Sleep changes. Poor sleep doesn't just make you tired, it can physically damage the brain over time. Deep sleep is when your brain's cleaning crew works, clearing away harmful proteins like beta amyloid, the very substance that forms Alzheimer's plaques. If you've had years of insomnia, restless nights, vivid nightmares, or feeling exhausted even after a full night in bed, your brain may not be getting the maintenance it needs. The fourth sign: subtle personality shifts. This isn't about suddenly becoming someone else. It's small changes that family or friends might notice before you do. Maybe you've always been patient, but now you snap more easily. Or you lose interest in hobbies you used to love. Some people become more anxious, others more withdrawn. These are changes in the brain's frontal lobe, the region that helps regulate emotion, empathy, and social behavior. Number 5. Trouble finding the right words, and not just occasionally forgetting a name. In early Alzheimer's, people often substitute vague words like thing or stuff more often, or pause mid-sentence because the exact word is stuck on the tip of the tongue. This can happen decades before more obvious confusion sets in. It's called anomic aphasia, and while it might start as a small frustration, over time it can lead to avoiding conversations altogether. The sixth silent sign: changes in posture and movement. You might start walking with smaller steps, dragging your feet slightly, or leaning to one side without realizing it. Coordination might feel just a bit off. Many people assume this is just normal aging or arthritis, but it can also be an early neurological shift. Number 7. Changes in taste and appetite. This one's fascinating. Alzheimer's can alter the way your brain processes taste, leading to a preference for sweeter foods or a sudden disinterest in meals you once loved. Sometimes it's paired with that reduced sense of smell, making food seem bland, which then affects nutrition and weight. Number 8. Apathy, that quiet loss of motivation. You might skip social events, avoid projects you used to enjoy, or just not feel like it most of the time. Unlike depression, apathy often doesn't come with deep sadness. It's more of an emotional flatness that can creep in slowly. Number 9. Spatial disorientation. Getting turned around in familiar places, struggling to follow a map, or feeling unsure which way to turn in your own neighborhood. At first, it might just feel like distraction, but it's actually the brain's navigation center struggling. And finally, number 10. Subtle grip strength decline. Research shows weaker grip strength in midlife can predict higher Alzheimer's risk later on, especially in women. This is partly because muscle strength is tied to overall brain health and circulation. Now, I know this list might feel overwhelming, but here's the empowering part. Alzheimer's is not an inevitable part of aging. You can influence your brain's future by what you do starting today. So, what can you do if you notice one or more of these signs? Science points to several powerful, natural strategies. First, move your body daily. Exercise increases blood flow to the brain and stimulates growth factors that protect neurons. Aim for a mix of aerobic activity, strength training, and simple balance exercises. Second, nourish your brain with the right foods. Studies show that diets rich in leafy greens, berries, extra virgin olive oil, nuts, and fatty fish can protect against cognitive decline. Avoid ultra-processed foods, sugary snacks, and reheated seed oils, which fuel inflammation in the brain. Third, train your brain. Learn a language, play an instrument, or simply take a different route to the store. Novelty challenges the brain, building what's called cognitive reserve, your mental backup system. Fourth, protect your sleep like it's medicine. Create a calm bedtime routine, dim the lights, avoid screens before bed, and keep a cool, dark sleeping environment. Fifth, manage stress. Chronic stress bathes the brain in cortisol, a hormone that shrinks memory centers. Deep breathing, meditation, prayer, and even gentle stretching can bring stress levels down. And finally, check your hearing. Midlife hearing loss is one of the biggest modifiable risk factors for dementia. Even mild hearing loss can strain the brain's processing ability, so treating it early protects your cognitive health. Remember, Alzheimer's doesn't just appear overnight. It whispers. And if you learn to hear those whispers, you can act before it shouts. So, keep this list, share it with the women you care about, and let's create a future where our minds stay as sharp as our spirits. If you found value in this, please subscribe so you don't miss the natural, science-backed tips I share every week to help you protect your brain, balance your body, and age with grace and confidence. And in our next video, 30 days taking turmeric and this will happen. We'll explore how this golden spice can actually cross into your brain and fight the very inflammation that fuels Alzheimer's. Trust me, you won't want to miss that one.